Well, thank you for joining us here this afternoon or evening, whatever time it is that you're choosing to watch this video. We are here on Friday, July 24th, and we are going to try to answer some questions to help you as parents and teachers and staff members better understand what the start of school might look like for the 2021 school year. With me today is Linda Jackson. She works for NBC News, but she's also a mom and a community member here in Northwest Allen. She's not here today as a member of the news media. She is here as a mom who, like you, has questions about whether or not it would be safe for her child to come back and what do those conditions look like. And so we appreciate her opportunity or her willingness to be here today to help answer the questions that are on your mind so that we can get the information out to you. Thank you, Linda, for being here.
Thanks for having me, Dr. Himsel. I really do appreciate it. And yes, I am from Fort Wayne's NBC, but I am very proud Northwest Allen County Schools parent, and go Carol. And my son graduated in 2015 and just graduated last year from IU. And we keep Northwest and all the schools and the teachers he had very, very close to our hearts all the time, and have been thinking of you. He's my one and only. So knowing that all you parents and teachers are going through so much, because as we chatted before this recording began, things are so up in the air. And it can be very difficult to deal with that. But I'm a true believer in clear, good communication, and that's what this is all about. So thank you very much for allowing me to be here. Let's tell everybody at home the first day of school.
Yep. First day, we're planning on August the 12th. At this moment, we are not planning to make a change. However, as we've learned since February, we do need to be flexible, and if new information comes forth that causes us to change that date, we will communicate it. But at this particular moment in time, we are planning with sticking with our August 12th start date for the 2020-2021 school year.
I have likened it lately to juggling in the circus. I can imagine what a good juggler you are these days. What will the day look like for, let's begin with the youngest students, Dr. Himsel?
You know, what we're going to try to do for all of our kids is to try to make it as normal as possible. But it's not going to be the typical normal school year, because we are living in conditions that are different from what we did the last time they were here physically on site. What the youngest kids are going to do is that that's where it's going to probably be the closest to being as normal as possible. But they will be wearing masks. They will be physically distanced apart from other students, the most that we can do that in a practical way. There's going to be less of the hugging and the high fives than what we've done in the past, but that doesn't mean it's going to go away. Our youngest kids in particular are spontaneous with that, and we're not going to eliminate that spontaneousness. But we are going to be safer. We're going to be a little bit more careful, and we are going to work with kids in terms of hand washing, hand sanitizing, and doing some things like that. As you move up in the intermediate grades, it's going to be wearing masks. It's going to be physically distancing as much as we can within those classrooms. Again, hand washing, hand sanitizing. They're probably going to notice a little bit less group work, less of getting together and with their peers. And we're still going to do that because it's an effective teaching strategy. There's just going to be less of it. And they may be for shorter time periods. We know that based on what we've learned from the doctors, the current guidance is that we want to be more than 6 feet apart. And if we have to be less than 6 feet apart, we want to try to do it for less than 15 minutes at a time. And so you're going to see less of the group work, and when we do group work, it'll be for shorter durations. In all of our elementary schools, when they go to lunch, they're going to be staggered lunch periods. There's going to be more distance in the cafeteria. There's not going to be self-service. There's going to be more grab and go or service from the cafeteria workers. We're going to be utilizing plasticware prepackaged in plastic with a napkin so that they don't have to pick through the different silverware. We will probably still continue to use the washable trays, but we're going to be using the disposable utensils and different things like that. We're still going to cook fresh food. We are not going to go the way in any of our schools, go to the way of just having all prepackaged, but there will be more prepackaged than what we've had in the past. But our food service workers pride themselves on providing fresh options. they want to continue to do that, there will just be fewer options, and there won't be the self-service where the kids will get to pick the portion, or maybe not as many choices on their vegetable choice. There may be more limited options in that regard. The a la carte options that some kids love, and those of us as parents get surprised by, because we find the accounts the money goes faster than maybe what we were thinking it was going to. There's going to be less options of those. In some cases, there won't be any options, at least maybe not at the start. But as time goes on, we may incorporate some of those back in. They'll just be more limited than what they've been in the past.
Okay. What about busing? Because I know from reporting in the news, social distancing and mask wearing and all of that comes into busing and keeping families together. Talk about that.
Busing is more complicated. We can't grow the size of our buses, just like we can't grow the size of our classrooms. We also have to live within the budgets and the resources that we have, and we also have to be able to be realistic on how many employees. I mean, we've had bus driver shortages for several years. That's not a new phenomenon. That goes back several years. So we're limited on the number of buses, we're limited on the number of drivers and routes, and we're limited by the size of those buses. So we're not going to be able to maintain as much physical distance as we would like, but we will maximize it as much as we can. We will do some things such as sit the older elementary schools in the back of the bus. They're a little bit more independent and have more experience of knowing how to escape the back of the bus in case an emergency happens, and set the younger students up closer to the bus driver so that if we do happen to have one of those rare emergencies, the bus driver can help those younger kids. We will, whenever it's practical, try to sit family members together since they're already going home together. We will have assigned seating. Unfortunately, one of the changes that really affects the elementary school probably more than the other levels is we may not be able to make a change in the middle of the day to go home with a friend. And we're going to have to stick with our normal routine bus assignments. Because if we do have a person have COVID and have a case, we will need to report to the Allen County Department of Health who is sitting near that person. And so by having seating charts, by keeping seating the same on most days, we reduce how many kids have to be quarantined or number of families that might be affected by a case. And that's what's important to understand is every piece of our reopening plans are designed to accomplish two things. One is to reduce the number of cases so that our families don't have to interact with it, hopefully. And the second one is when there is a case, we reduce how many kids have to be quarantined or the number of families affected by it by reducing how many kids are near the person with the case. If we did not implement these things, it would increase the chances that we would have to quarantine an entire class or an entire grade level or an entire school. And we don't want those interruptions. The easy part is opening. The hard part is avoiding the interruptions that might come up. As the doctors have informed us, we're going to probably have cases. And it may or may not be because of the school. It could be because of religious services or family gatherings, going to a restaurant, going to a store, other activities that take place outside of school, youth sports, travel teams. It may or may not have anything to do with the school, because it's everywhere in our community. But wherever it is that it happens, we have to deal with the ramifications and keep people safe, and that's what we're going to do. And we're partners with the Allen County Department of Health. We will follow their directives as they have to follow the directives that they get from the Indiana State Department of Health.
Safety and communication. How does remote learning play a role in all of this and choice?
Remote learning is playing a major role, and it's got two pieces to it. The first piece is recognizing that the decision for on-site or remote learning is a very difficult one, and it's very personal. There's one thing to look at all the averages and make decisions on how we can best move forward. It's another one to look at your individual child and the potential underlying medical issues of that child or someone else in your family. We encourage all of our families to talk to their pediatrician or family health care provider to determine what's best for their individual child and their family. And if remote learning is best for them, we are going to have a remote learning option for them. We do ask for a commitment of one semester because of just the staffing complications and making sure that we have enough staff and we have the right amount of staff devoted to provide the attention that's needed for each of our kids. We also have the on-site version for those who can come to school, and those two things are not easy. But I do encourage families to visit the American Academy of Pediatrics website that has information of weighing and balancing the underlying health issues that may be involved with the mental health issues of not going back to school. And these are not easy decisions. And that's why we encourage our families to involve their individual home, personal pediatrician, or family health care provider. The second piece of remote learning are not for those families who decide they want a full semester of remote learning, but for those who are on site, and then during the course of the semester, there's a case that comes up, or they become sick, or they become quarantined because they sat next to someone who had a case, a confirmed case. In that case, we also have some temporary e-learning opportunities for them that may include doing some live streaming of the class that they normally attend, but it also may involve just some uploading of videos or work on their Canvas page, which they've been accustomed to doing when they've been sick in previous years. Because the live streaming is not going to be possible in all cases, but when it is possible, that is going to be one of the options. Because if you're quarantined, if the Allen County Department of Health contacts the family and says you're going to be quarantined because there was a contact, whether that contact happened at school or somewhere else, it's likely to be 14 days or the equivalent of 10 school days. We don't want any child to fall 10 school days behind. We need to keep them engaged, especially given a quarantine means your child may not be sick. They were just exposed. And so if they're not sick, they can keep up, and that's why we have these temporary options so that they don't fall further behind, and they do keep up with the peers that are going on in the classroom.
That flexibility is present, and I think for reassuring purposes for folks at home, guardians and parents, to know that you have that flexibility, to know that the lines of communication are open, take advantage of that. It's very important.
I will also tell you that that's what complicates this and makes it harder to work through, but it's the right thing to do, and we're going to provide that flexibility for our families.
Okay, I'm Linda Jackson from Fort Wayne's NBC. More importantly in this setting, a proud Carroll mom and Northwest Allen County Schools mom. I'm with Dr. Chris Himsel, Superintendent, and we've been talking about different topics. Right now we want to look at March 13th. Everything closed down, and since then things have really changed quite a bit. How have they changed? And I think safety is number one on everybody's mind, along with getting an education. How are things going to be safe for the kids?
Things are different. One of the things that happened when we did close on March 13th, it was because our medical experts and public health experts, in looking at all the data that was coming up, and there was beginning to have some cases in the Indianapolis area, and I think there may have even been a local case about that same week, was a lot of unknown. We asked the doctors, what is different about the advice to close back in March versus the advice to try to reopen here in July in preparation for August? And they said the main difference is we know more. We just know more information. In March, we did not know how it affected children. We did not know how it was going to affect different biology or genetic makeup. We didn't know if it was going to affect younger people differently than older people, because all of our information was coming from other countries. Now we have our own firsthand information. We have cases here locally that we can learn from. We have cases in neighboring counties and throughout the state that we can learn from. And because of that, what we've learned is, unlike some other illnesses, it isn't as widespread through kids as it is in adults, and that was something that surprised them. We also went to the point where back in March, the advice was heavy, very heavily focused on hand washing, not touching our face, and cleaning and disinfecting commonly touched and frequently touched surfaces. Now we're getting an emphasis on maintaining physical distance, wearing a mask, and that's because they've learned more about how the virus spreads. We still need to maintain clean environments in terms of the disinfecting and cleaning, good hygiene practices, but we also now know that wearing a mask and maintaining physical distance is an important piece of this. So in all of our schools, we are going to be trying to maximize the physical distance we can at all times. Because we can't grow the size of our classrooms or the size of our buses, it's not going to be possible in all cases, which is why we're going to be requiring mask wearing. There will be opportunities during the day, or at least we're going to try to find opportunities during the day, where we can get relief from wearing the mask by creating those greater physical distances. We're going to visit outside when we can. Our classrooms, if the activity is conducive to it and the weather is good, we may go outside for the activity so we can get a break from wearing the mask. But we are going to be wearing masks because we're not going to be able to maintain that physical distance at all times. We are also going to have cleaning procedures so that commonly shared items are going to be cleaned before the use and then again after each use. We're going to have multiple cleanings and disinfectings of those areas and common touch points, lobbies, restrooms, different places like that. And then we're going to have deeper cleanings in the evenings and on the weekends. We're also going to continue to practice good hygiene. We're going to have a lot more hand sanitizer accessible. We're going to increase the number of opportunities to wash our hands. We always teach blowing our nose and how to cough and sneeze with our youngest students. We're probably going to be reiterating that more with our older students and reminding them, and probably teaching a little bit sooner in the year and maybe a little bit more aggressively with our younger students than maybe what we would have done in past years. So it's all those things, but we've even went so far as to have an engineer come and take a look at all of our HVAC systems and talk about how do we filter the air and how many air exchanges do we have so that the air doesn't get stale and it's constantly turning over. And so we've maximized all of those within the requirements of our HVAC units. And we've always had air quality cleaner than what was required, but we are now going to maximize those filtering capabilities to make it the absolute cleanest it can be, not just being cleaner than what is expected, but being as clean as it is possible to be. And our HVAC units will handle. So those are some things we're doing to try to make it safe, to make it clean. And that's why it's different today, is we just know more. And the doctors have been a great resource to help us understand that.
Linda Jackson here with Dr. Himsel, and we continue our talk. These are some questions coming in from social media from families. How similar or different will remote learning be compared to last spring specifically? Have you heard anything about reducing state mandated testing for this year? And how will teachers juggle, again, those types? Will they have some scheduling changes, or will they have assistants come in? Talk about that.
Great question. And I think it's easy to forget because our teachers just did an amazing job from making the announcement on March 13th that we were closing, and on March 18th engaging in remote learning. And they were just incredibly awesome at turning that around. Before March 18th, they had only done e-learning one time in our history, which was last November when we had some icy roads. It was the first time we'd ever done e-learning. Last year was the first year we had got our training, gotten all the computers out, helped the kids understand and access Canvas, gotten our professional development to where we could try e-learning for the first time. So when we started on March 18th, we had only done it for one day. And on March 18th, we suddenly had to become really good at it because it was going to go until April 13th. And then as we found out later, it ended up being subsequently to the end of the school year. One of the things that's key in terms of different is because of where we were in the school year, we only had 46 days remaining in the school year. But 24 of those 46 days were going to be interrupted with state standardized testing and other activities like your award ceremony and field days. So we really only had 22 days worth of content remaining to be taught, because when we are interrupted with state testing, we typically do not teach new content. We typically do review type of activities and other kind of activities so that the kids stay fresh for the state testing. So we had 22 days of content, and we had 46 days left to teach it. So therefore, we had a completely different mindset, which bought us some time to use new tools, to try new things and try to adapt and become better at remote learning. So what's different this year is, as we enter the school year, we have the entire year's worth of content. So now we're going to have to take all the lessons we learned last spring, and we're going to have to be more intense. The duration's going to be longer than what it was in the spring because we have a full year's worth of content to teach. And even if you only choose remote learning for a semester, when you come back second semester, you can't be behind your peers who have been on site for that semester. So it's going to look very different in terms of the duration, the intensity. There's going to be more opportunities for small group interactions or individual teachers to get on Zoom to do some assessments and some individual help that maybe wasn't done back in the spring. And we're just thankful that we had the opportunity to try things, to learn some things, to become more proficient at it. And it's going to help us be better this fall as we have to do it in a completely different context than we did last year. Because state testing was canceled, that's part of the reason why we had this opportunity. At this moment in time, the answer is no. We have not been informed that state testing is going to go away. However, in my personal opinion, it would be a better use to invest those funds typically used for state testing into helping mitigate the effects of COVID, whether it's additional staff members, instructional assistants to assist, more teachers so we can lower class sizes, overtime for custodians to do more cleaning, to purchase more PPE than it would be to get standardized tests. But I also do that from a perspective, our state standardized test doesn't give us any information that's helpful from an instructional perspective. That's why we do NWEA here in our district. It is far less disruptive. It takes far less time, and it provides our teachers with far more information in terms of what kids do well and what kids still need practice and work on in order to get better. Our state testing simply does not do that.
Thank you for being with us and staying with us. I'm Linda Jackson, and I'm talking with Dr. Chris Himsel, Superintendent of Northwest Allen County Schools, about the issues that you have with back to school and some of the questions you may have, moms, dads, and guardians out there. Dr. Himsel, I'm wondering if this might be at the top of everyone's list, but as superintendent, what's the advice that you give to families on how children can be best prepared for going back to school?
You know, as a father of 5, I'm living this. And it is one of those things. I think it comes down to a couple different things. The first one is our parents need to reach out to their pediatricians and their personal family healthcare provider to determine what is the best solution for their children. Is it on-site or is it remote learning? Your pediatrician knows more about your child's patterns on illnesses, how much they have an immune system that fights things off and so forth, and they can give you better advice. They can also help explain those other things about the mental health aspects of just normal child development and being with their peers and all those things, and help each of our parents balance that. The second thing is, and I'm very fortunate to be married to a very bright lady who thinks of these things when I don't. But she's already purchased the mask for our kids so that our kids can start practicing and getting used to what it's like. And she also kind of made it a game and let them choose what kinds of things they want. So I know that I've got one that's got a Spider-Man and one that's got sharks, and they participated in helping do that so that we can add some fun to it in terms of our elementary age children. And now they're practicing wearing it, and each day we do it for a little bit longer than we did the day before as we build up towards August the 12th. The last thing that I'll mention is attitude's everything. And it's hard as a parent in today's world not to have anxiety, and our kids pick up on it. And as much as when we are working with our children about coming back to school, the more that we can elicit confidence and calm that everything's going to be okay, our kids are going to be more likely to elicit confidence and calm when it goes to coming back. Our kids miss seeing their friends. They miss having interactions. And most importantly, they miss being in a routine. And that's some of the advantages of thinking about the on-site environment. But if we have parents that are overly anxious and they pass that on to their kids will likely be overly anxious as well. And that's very difficult. And my wife and I have a lot of conversations when the kids are not around after they go to bed. Or sometimes we go together to drive and pick up one of our kids so that we can have that private time in the car. Fortunately, we have an older child who can watch the younger ones. So that we make sure that those conversations that we have where we do have some anxiousness and we do have to talk through those things are not done in the presence of our kids, so that when it does come time to come back to school, they have some excitement about going back and seeing their friends with some confidence that my teachers are going to take good care of me.
Linda Jackson again with Dr. Himsel, and we're having our back to school chat about topic after topic after topic, and this one may interest you, guardians and parents there at home. Dr. Himsel, if parents choose on-site instruction, but cases progress significantly, cases of COVID, will you close the school, or do you even have the capacity to shift gears to perhaps all remote learning at that point?
Well, first off, do we have the capacity to shift and pivot into remote learning? I think last year, March 13th to March 18th, in that 5-day period of time, we proved that we can do that. As difficult as it was, we did it, and we did it because we've got we're blessed with just so many dedicated people here who want our kids to do well. In terms of how cases progress, there's some terms we need to start getting used to. There's the term isolation, which is a term that's going to be used when we have a confirmed case of COVID. So if your child has a confirmed case of COVID, the health department is going to say that you need to isolate them or keep them away from other people as much as possible so it doesn't spread to other people. There's also going to be the term quarantine. The term quarantine means your child's healthy. As of right now, they're not sick. But we know that they've been exposed to somebody who does have a confirmed case of COVID. And the way they rule that is what they consider high-risk exposures. High-risk exposures are less than 6 feet apart for more than 15 minutes. So all of our classrooms are going to have seating charts. We're going to have lots of procedures in place so that we don't have an intermixing of a lot of kids on a regular basis, so that if we have a confirmed case, we can limit and make as small group as possible that is within that 6 feet distance, so that we have the smallest number possible that gets quarantined. Because that's the interruption to the school year that we're going to try to avoid and try to do that. So that's why we're going to have seating charts. That's why we're going to try not to have the first grade eat lunch and not intermix with the second grade. And then the second grade comes down and they don't intermix with the third grade. That's why at the middle school and the high school cafeterias, we're going to have the tables spread apart as far as we can get them. Whenever it's possible to have seats in between that are empty, we're going to try to do that. We need kids to help us with that. When I watch them out right now, they're doing what kids do. They forget, and they get close together, and what they're doing when they get close together is if one of them unknowingly has it, because they came in contact with someone who they did not know had it, they're exposing all their friends who are close by to possibly needing to be quarantined. That's why wearing the mask, that's why maintaining distance is so important. We are doing everything within our plans is to minimize the number of people who might need to be quarantined so that we can avoid an entire class being quarantined or an entire grade level being quarantined or an entire school. But it's the Allen County Department of Health that will make decisions regarding quarantine. It will not be us. We will work with the Allen County Department of Health. We will maintain all the HIPAA requirements and stay within all that and provide them with the information they need to make sure our community and our public at large is as safe as possible so that they can contain as many of these cases as possible so it's not out in our community being spread to other people. But they have to live within the guidelines of the Indiana State Department of Health. So they're rules followers. That's what they've been charged to do. They're going to follow their rules. They've got flow charts that they do to determine who gets quarantined and who doesn't. The last term that our parents may need to get used to is called self-monitoring. And self-monitoring just means monitor your health, monitor your symptoms. At this point in time, what's been a doctor gave me the advice that it's so widespread in parts of our community and throughout parts of our state, it's in our best interest just to always be self-monitoring. Just constantly monitor your symptoms. The number one thing that we can do, the number one safety thing that can be done, and we haven't talked about it yet, is stay home when you're sick. If there's nobody with a case of COVID in our schools, then we don't have to worry about whether or not someone forgets to put on their mask or forgets to be social distance. But because we don't always know, we're going to be wearing our mask and we're going to try to maximize those physical distances because it's possible that you don't even know you have it. And you come to work and so forth because you don't show any symptoms. And that's what makes this very complicated. We're used to the flu when we start feeling bad, and when we start feeling bad, we know to stay away from people, or you notice that they don't look like they feel well, so you stay away from them. COVID's a little bit different in that the symptoms aren't always obvious. For some people, it's a very serious illness. For others, the doctors have reported they may not even know they had it because it was so mild. So it's what complicates it and makes it hard. But if you have the symptoms, if you are sick, you need to stay at home. And we have adjusted our attendance policies and put in some flexibility so that they're not penalized because they're doing what's best for the entire public.
Hi everyone, Linda Jackson with Dr. Himsel. We continue our, fireside chat about back to school topics and questions that you have submitted on social media to the school district, and we're trying to cover as much of that as possible. Here's one from you at home, folks. Dr. Himsel, who handles contact tracing and determines when a student or a staff member can return to school after dealing with a case of COVID?
Well, in terms of the contact tracing, in terms of dealing with someone who does have COVID, the Allen County Department of Health is going to be our partner, and they will be making the isolation and the quarantining decisions. What we will be doing is maintaining seating charts and our daily routines so that we can share them with them so that they can analyze that and determine what families they need to contact. And we will help in the participation of the communication piece. But the decisions are made by the Allen County Department of Health. But with 55,000 students throughout the entire community and other residents who are also interacting in religious services and going to stores and so forth, it can be pretty overwhelming for their staff. So we will be assisting in the communication part, but they will be making the decisions regarding the quarantining. What I understand, and this is everything since February has been fluid and subject to change, but my understanding at this moment in time is that if a person has a confirmed case of COVID, they will need to stay home for at least 10 days. And on top of the 10 days, it's 10 days and 72 hours of being fever-free and symptom-free. And fever-free doesn't mean the help of ibuprofen or a Tylenol or acetaminophen. It's without the aids of additional medicine. In terms of a quarantine, which again is someone who's healthy, but it's just been exposed, and what we're doing is keeping them at home so that if they do develop symptoms, they don't spread them asymptomatically in the meantime. Quarantining will be for 14 days. And that's 14 calendar days, not 14 school days. So 14 calendar days is going to be equivalent to about 10 school days. And that's why we've created these temporary e-learning opportunities so that kids can still keep up from home, even if they happen to be quarantined and healthy and able to do that work. They can still keep up. They're just going to do it from home through some modified temporary e-learning that we'll do through Canvas.
All right, we continue our talk about the back to school questions that you might have, and one of them was, Dr. Himsel, for families who may not have internet access or the best internet access out there, and this is something that is a part of each and every school system in Allen County and all over, what do you say to those families, and how can they receive some help maybe?
The good news is the vast majority of our families do have some pretty good internet, but we do have families that do not. And the other part that's good news is there are some resources out there to help those families. What we ask is, if your family's internet does not allow for video interactions, for live streaming when the live streaming is possible, or for accessing things on Canvas, is to please contact us so that we can either work on getting a thumb drive with some recordings on it, or we can connect you to those community resources through Comcast and Frontier and others to see if we can help get internet set up. There's a broadband coalition in Allen County that is working on trying to find ways of expanding internet access into the rural parts of our district or of the county. We've also are working with what they call a GEAR grant, and we're in partnership with Southwest and East Allen to see if we can come up with some additional resources. So we don't know if we're going to get the grant. The broadband coalition is not going to work as fast as we would all like for it to work, but there is a group in Allen County working to try to expand that, and I would expect there to be some changes and some movement and improvements throughout the year. I just don't know how quickly they're going to come, and I don't know which area is going to get it first. But there are people working on this issue. So the key part of this is contact your guidance counselor or the building principal, because there may be some options that we can connect with you to make sure that your child has access to these resources that are available.
Linda Jackson with Dr. Himsel, continuing our chat about back to school. And, you know, with any topic, it seems things typically come down to the bottom line, which is money. Are you comfortable with the amount of funding that's available right now to meet some of the concerns that you may have with this unprecedented situation?
Before I begin into some of the funding things, the first thing I want to say is thank you to Governor Holcomb. His decision to keep our funding whole for the 2020-2021 school year, that decision that he made in the middle of the summer was, one, a surprise to me, but something that, no, it wasn't. But it was so thankful because it allowed me to move forward with some staffing decisions that I was not making because I didn't know if I had to make budget cuts on top of getting ready for reopening. And the fact that he didn't do that at least gives me comfort that I could move forward with some staffing decisions in preparation for making reopening happen. However, it's not everything. We're going to have to run more bus routes than we typically do in order to do some social distancing. We're going to be extending the amount of time that our lunch service is available, which means we're extending the amount of time that our recess aides, lunch aides, and our food service workers are going to be working. So instead of working their normal hours, we're going to extend those hours in order to provide the social distancing for the kids to eat in the cafeteria. We're going to be paying overtime for custodians to do additional cleaning and more deep cleaning on weekends or in the evening so that we're ready for each day. And then because we're going to run a dual track of remote learning and on-site learning, we're going to need some additional staff because it's just not possible for the staff members to teach all day on-site and then also teach remote learning classes. We may be forced to do that in some unique situations, like there's just not a lot of Japanese teachers that are out there for us to hire. But there's other places where we would be able to hire some people to provide that dual parallel track. So with all that, there's a lot more expenses, and then we didn't even talk about PPE and all the other stuff that goes with this. So that's why we're looking for the federal government to have some help. We know that our state government is probably not going to be able to do that based on what we're hearing from their revenue and their collections. And we're just grateful and appreciative that we've got the funding we were expecting for this school year to be able to move forward with some staffing decisions. But we still are trying to figure out how do you meet these additional COVID-related expenses or investments that are not recurring. We only expect them to be here for the duration of COVID. And that's why we're trying to work with Congress to do this. And to put some perspective, when the Great Recession happened, we served 1,600 fewer students than we do today. And during that time, we got over $4 million of funding to help us through that Great Recession over a couple-year period of time, which allowed our state some time to kind of catch up and us not to make draconian cuts on the services we provide kids. And even with that $4 million of assistance, we still had to lay off 30 employees, and we still had to take a 3% pay cut in order to make ends meet and provide the services for the children we're blessed to serve. So today, we serve 1,600 more students, and we have all these COVID-related things, and in the background, when we think about the budgets for the next 2 years from the state level, if things don't change in our state, the state's going to have a difficulty in terms of how do they move forward on their budgeting process for the next biennium budget. We've only gotten $300,000 from the federal government from the CARES Act. I'm very appreciative that Congress provided more flexibility for this funding than we got back during the Great Recession. So therefore, I had more flexibility to do what was right for Northwest Allen instead of being pigeonholed into all of us being the same. So all 4 school corporations in Allen County have spent it differently because we all 4 had different needs. That flexibility was appreciated. But the fact that we got $300,000 to accommodate all this, whereas before we got $4 million, and even with the $4 million, we had to lay off staff members and negotiate budget cuts, it makes me really nervous when you think about all the COVID-related stuff that's going to be non-recurring. It's just a 1-year set of investments to reopen and do it the right way. And then you think long-term in terms of what might happen with the next state biennium budget. It does make me nervous from being able to try to figure out how to meet the needs of children moving forward and into the future. The immediate concern, though, is just how do we have the resources to open the right way and stay open with as few of interruptions as possible. And it's going to take more staffing, it's going to take more hours, it's going to take more cleaning, it's going to take more PPE. We're committed to making it work. We just need some commitment from Congress that they recognize that this is one of the things that we're struggling with. The easy part is saying we're going to be open. The hard part is doing it in a way that's right for children, that keeps children safer, and also does it in a way that prevents the number of interruptions that could occur if we don't have all the necessary resources to make this happen.
Are you in contact with our area leaders on the Hill?
I am. I've been in contact with them, and they're listening, which is definitely encouraging. I know that one, in particular, I know that Senator Young had some meetings in the area, not with me specifically, but I know from our Superintendent's Association, he met with a group of people who shared some of these thoughts, and we're hopeful that something happens soon. One of the things that's different is because Indiana starts school a little bit earlier than maybe they do in some other states. Maybe some members of Congress don't have the sense of urgency, but we continue to be hopeful. We continue to work with them in hopefully a positive way and help them understand what it is that we need to do it the right way. We're not doing this for any other reason than we want to make sure that every child who comes to our door, we're doing everything that we can to keep them as safe as possible and to make sure we're protecting our employees. To make sure that our employees are not going to need to be quarantined or be isolated or be in those things where we lose man hours from that standpoint. And that's also a big concern of mine, is just how do we maintain full staffing throughout the year when we have teacher shortages, we have shortages with bus drivers, shortages with custodians, shortages with substitute teachers to start with, and then it's complicated by all the stuff we have going on with COVID also. So we just need to keep as many people healthy as possible, which is going to take a great deal of investments to do it the right way.
Linda Jackson with Dr. Himsel, and we're going to wrap up our talk right now. I do want to encourage my fellow parents and guardians of our precious students here in Northwest Allen County Schools to remember you can reach out to the folks in Washington, let them know your thoughts, your questions, and of course you can reach out via social media, or as Dr. Himsel referred to earlier in our chat, you can call your building's guidance counselor or principals, and if you have questions, the lines of communication are open. I'd like you to take an opportunity, if you don't mind, Dr. Himsel, to encourage everyone at home as we all deal with this uncertainty, especially the parents of school children returning here in this fall semester.
We miss them. We miss their kids. We miss interacting with the parents. Hopefully they miss us as well. But more importantly, I know that the kids miss their friends. And we have been working since the day we announced the closure on March 13th. We have been working with how do we reopen, and how do we reopen in the safest way possible. I have faith that we've put together a plan that fits within all the recommendations that our doctors are doing within the resources we have available. And we are so appreciative of our medical experts and public health experts that have been very patient with me as they help teach me some things that's not in my field of expertise to understand how do you maximize when the classroom's not going to grow. We're here in a 900 square foot classroom. It's going to stay 900 square feet. And so how do we do this in a way that still provides the safest opportunity? And they've helped us do that, and I think we have a plan that's going to do that. we're going to take good care of your kids. We've always tried to take good care of your kids, but it doesn't mean that something's not going to happen. And that's the reason why parents need to reach out to their pediatrician, to their family health care provider, to make sure they're making the decisions in the best interest of their child and so forth. And beyond that, we're going to try to make it as normal as we can and have interactions and let friends be friends and interact and try to put some of this anxiety of the unknown away so that we can get back into some routines of normalcy, knowing that it's still going to be different. It's not going to be completely normal, but it's going to be closer than what we have been for the past several months. Believe in our parents. We're blessed to serve the kids that we're blessed to serve. This is a great community, and they've been very supportive. We're going to need patience. We're also going to need the community to pull together and help us keep schools open by doing their part to make sure our cases in the community at large stay under control. And that means wearing a mask and being social distanced and being smart with our hand washing and cleaning and disinfecting so that our entire community can get back towards normal and keep this under control. And we're looking forward to it, and we've been trying to become part of the solution. We've been trying to be reopen and do it the right way. We also understand it's not right for everybody, and that's why we have the remote learning options. Regardless of what they choose, we're going to take good care of your kids, and we're just going to try to do the best we can to create healthy and safe learning environments, engage our kids in meaningful learning activities, support them when they need to be supported, and challenge them to go further than they ever thought possible.
Wow, I wish you the best, wish everyone at home the best. Have a good school year. And thank you for asking me to help with this. I really appreciate the opportunity.
Thank you for coming in here and putting your mom hat on for a little bit.
I like that hat a lot.